So here I am once again in front of you with the topic that we have a new friend here now, Mr. Henry, or you can say Dr. Henry to him. So what we are going to talk about now, as we have discussed in the previous lecture about the skeletal system. So in the previous lecture what we have discussed about the functions of the skeletal system. If you just go through your notes once again, what we have discussed on the last class about the functioning of the skeletal system. So different functions which we have discussed earlier, that was your, it gave you the support, framework, alignment. Then we have discussed about the protection to the organs. It gives the protection to the organs. Yes, it is responsible for the locomotion or movement, responsible for the production of blood cells, and we have discussed about the storage of calcium and minerals. Now, as you see, this whole is the skeletal system. But anatomically, if we talk about, skeletal system is divided into two parts. The skeletal system, yes, we see that the whole is your skeletal system. Different bones we have. So if we ask you that how many bones we have in an adult, 206. So total bones 206. Sometimes it is 2 or 1 more in some individuals. So if we're talking about the skeletal system, let's go through the skeletal system right now. That so classification of the skeletal system, how it divides. So it divides into the two parts that we call the axial and appendicular. The axial skeletal system and the appendicular skeletal system. Now the thing comes to your mind, the question raises to your mind, what does it mean? First and foremost, we have to clear about that, my dear friends. That what is axial and what is appendicular. Axial, if we work on the basics, very basics, that axis, what does the axis means? Not in relation to the body. Normally, if we talk about what does it means, the axis. So axial relates to the axis. And what does that mean? The axis means, in general, what you say, the center point of the body or any center point around the things revolve, around the things rotate. For that we call the axis. The axial, the axis. So what does it constitutes in relation to the body? It constitutes the central part of the body. So it constitutes the central part of the body. Or what we can say, it constitutes or it forms the central bony core of the body. That what does that axis means? So axis is the center. Around the things revolve, around the different structures revolve. And it constitutes central part of the body. The next come to the appendicular. What? Appendicular. Appendicular we use for the appendages. Appendages means for limbs or extremities. Axis is the center, and this, whatever the side which is left, the different components, that comes under your appendicular. So appendicular consists of your limbs or extremities. So axial, central part of the body, and the appendicular is your limbs or extremities, like your upper body, upper limb, lower body, lower limb. I hope that makes sense for you. Now we go slowly move forward. So the next question comes here. What is the next question comes here? what are the different components now? So right now I'm going to talk about axis one first, right? The axial skeletal system. So the question arises now, what are the different components that forms the axial skeletal system? This is the first question. So if we erase this one now and focus on the axis. So what are the different components that forms the axial skeletal system? So as we start from the up part of the body, upward part, right? As we start. So the first and foremost thing that comes over here, what we call it, the hole, which you can see if you rotate, we call it skull. So the first component is your skull. Then we say the next component which comes under is the whole spinal column, my dear friends. If I just turn around this one, and if you look at from here, after the skull, this is the whole spinal column which is here. So first component we say that skull, then just below the skull, what is the thing that start is your spinal column, the whole spinal column. Then if we turn around slowly, then you can see the center part here, that is we call the sternum, that is your chest bone, the front part of your chest bone. And if you look at from the side, what are these things which we call the structure? We call rib cage. So the four different components are here that forms your axial skeletal system. The first one we have discussed, that skull. Second one is your spinal column, the whole spinal column. The third one which we say that is your sternum. That is the front part of your chest bone. And the last one which we say that the whole rib cage. So these are the four components that forms the axial skeletal system. Just take a quick review about that. One more time. In the front part, we look that the whole part is your skull. Right? The skull. Then if we turn around, if you look at from the back part of the body, the posterior part, spinal column. The whole spinal column, you can look at there. This is your whole spinal column. Then if we turn around from here, then the part comes here, that is we call the sternum, the front part of your chest bone, and from the side we have rib cage. So this is the whole component that we call, that forms your axial skeletal system. So this is the component of the axial skeletal system. So now our main focus, if you have to focus mostly on this part, spinal column. Guys, if I'm going to talk about the spinal column, as a yoga teacher, not as a yoga trainer, as a yoga student, or anywhere where you are teaching or what you are studying, if you have a good knowledge on the spinal column, you can prevent 80 to 90% of injuries with your students. Because what happens that the spinal column is the center part of the body, isn't it? The spinal column is the center part of the body. Other parts of the bodies are also attached with the spine, right? Other parts of the body is also attached with the spine. So if I ask you, if the spinal mobility is affected, does it affect the mobility of the other joints also? Sometimes what you feel, the neck pain as you wake up in the morning and you feel, oh, I have a problem to lift my shoulder up. Does it happen or not? It happens. You have a lower back pain. The problem in the lower back. Why? But why there is a problem to the walking? Why there is a restriction in your hip joint, knee joint? Because if the spinal mobility has been affected, it also does affect the mobility of your other joints too. So that's why learn as much as you can about the spine, about the spine health, the different issues of the spine. Because what we say spinal column. But the whole spine has not the same function. The whole spine has not the same mobility. The whole spine column has not the same stability too. But if we talk about the spine has different components, and different component has different mobility and different stability. So some of the component is responsible for mobility, some of the component is responsible for the stability. But if you use the component which is responsible for mobility for stability, what happens? The injury occurs over there. If you use the component which is responsible for the stability and you use it for mobility, injury occurs. So spine is not a same part. Yes, we say the spinal column because it is situated in the single line. But the spine has different components and has different functions too. So guys, this is the request. If you want to just fine tune your teachings and you want to teach something different to your students and prevent the injuries mostly in the inversion, shoulder stand, backward bending and twisting, just take some time out, go through the spinal column and try to learn about the anatomy of the spine so you can prevent number of injuries and you can give the healing effect from your practices and you can feel the difference in your teachings from that day. So let's talk about the spinal column in a little bit detail. So we say that spinal or vertebral column, we also say vertebrae. The vertebral column. So the spinal or vertebral column, because you say sometimes vertebrae. So the first thing that starts from the spine, after the skull, what you say? Generally the neck. This part, what we say? Neck on the back of your skull. But anatomically, what we say? Cervical spine. We say cervical spine. Now the question arises, why we call it cervical spine? This is the first question. Because if you have seen that the baby, when the baby is in the womb, the infant is in the womb. So normal position of the baby is head down. Is it or not? The normal position of the baby is head down, except in the breech presentation. So what is the first thing when the baby delivers that comes out from the cervix of the female is this part, the skull and the cervical spine. So that's why we call it cervical spine. So the first thing that comes out in the normal delivery or in the normal labor, your head. And that comes out from the cervix first. That's why we call it cervical spine, guys. Now the question comes next, how many components it is? We have 33 vertebrae. Is it the whole is your cervical or whole is your that way? So 29 vertebrae we have, or 33 vertebrae we have. So from here, if we're talking about from the 33, the cervical spine, how many? It is 7. So what we say, C7. How many problems we have having nowadays? 20 years back, nobody talk about the cervical spine. Nowadays, everybody knows, the maximum number of population knows that cervical pain. How much we are using this spine every day? Mostly nowadays, in the cell phones. If you go 20 years back, when the mobile phone has been launched, was any camera? No. Any touch screen? No. Only the small screen button, hello and bye, that's it. But nowadays, as you get free time, what happens? Just check the WhatsApp, just check your mail, just check on the Facebook, just check on the Instagram. So this is overusing. And the question is, am I using the mobile rightly or correctly or not? So that's why the most tension, you're working on your laptops, you're driving a car, the neck is going like this. Isn't it? The neck is going like this way. So how much stress you are carrying on your neck muscles? And then you complain neck pain. I always tell to my students that, yes, the technology is improving, it is getting advanced. Then they gave you, the mobile phone gave you camera, back camera. You have to ask somebody to take my picture. Then they give you the touch screen. Now there is a front camera slowly and slowly. So how much problems is happening when you're taking your selfies? Your neck compression is there. You are chatting with someone like this way, check the neck is going forward. So problem is here that all the alignments are getting misaligned. So that's why in the alignment classes also I told you guys that anatomy has an important connection with the alignment. If you know about what is the structure, then only you can adjust. If you don't know that this is the water, when you're thirsty, you don't know that this is the water. Can you able to drink it? No. You may be scared, maybe it is a poison. So that's why there is a combination. If you have a good anatomical and physiological knowledge, alignment for you will get more easy. So that's why we are here to discuss about it first on the basics, my dear friend. So that's why overuse of this neck muscle, I call this part, the cervical spine, digital disaster. This is the digital disaster part nowadays. Right, the digital disaster. On the laptops, on the phone, on your PCs, always the neck is going like this way. Right, so always take a little pause in your life, check where is my neck and take it back. Bring some awareness, some muscle memory in your brain. Don't overuse those muscles. C7. Right, the cervical spine, digital disaster, number is C7. How many components? 7 vertebrae. And this is the smallest vertebra in the body. What do we say? This is the smallest vertebrae in the body. The smallest one. Now if I ask you normally, how many movements you can do? Or how many movements you can perform from your neck? Check right now. How many you can do? 1, right? 2, 3, 4, 5, 6, 7, 8. So if I ask you guys, or if I speak, or if I say that, does the neck has maximum mobility? If you compare to other part of the spinal column, you have checked right now. How many? So many movements you can do. Up, down, side rotation, side flexion. Number of movements are there, right? But if I ask you, somebody hits on your neck like this, what happens? It get easily twisted. Any injury over here, you fall down like this, or somebody hits from your back, mobility is less. Mobility is more, but the stability is less here. So that's the problem here. This is the cervical 7, this is the smallest vertebrae. So maximum mobility but less stability. That's why we say that it is most prone to injuries. What do we say? Most prone to injuries. So cervical spine, C7, this is the smallest vertebra in your body. Maximum mobility, less stability, and most prone to injuries. So if you look a little bit deeper now, guys, on the spinal column. So as we have discussed about the cervical spine, C7, smallest vertebrae, maximum mobility, less stability, and most prone to injuries. So I'm giving you like more detail, guys, that if you look at here now from the base of the skull, right? If you look at from here, the base of the skull, this is the first one. If you see that vertebrae that is little bit fused, if you look at on the other vertebrae here, you can see this notch, that is we call the spinous process, right? What we call it? Spinous process. But if you look at from the first one, if you can see that marker, this one, right? This one. So it is on the base that you call the atlas and axis. What do we say? Atlas and axis. So the first one is fused here. Second one, you can see this notch that we say spinous process. Third, fourth, fifth, sixth, and seven. So cervical, how many it is? These are seven. The one is fused, 2, 3, 4, 5, 6, and 7. So complete cervical spine, 7. It has maximum mobility, less stability. So nowadays what we have to check that the neck is going forward. So when the neck is going more forward here, like this. So what you can see, compression comes, right? The neck has its natural curve from here. Everybody has a natural curve, but if the neck is going forward, you destroy this curve. You create imbalance on this curve. So if my neck is neutral, that is okay, my muscles are active. But if my neck is going forward, 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 more forward, more forward, the pressure comes to my lower back too. Sometimes what people ask, I don't have any injury on my lower back, no mechanical injury, and still I am feeling a lower back pain. So what is the reason behind that? This neck, this cervical spine has design. It has to be designed just to bear the weight of skull. That is 6 to 8 kg. The cervical spine has designed to bear the weight of skull 6 to 8 kg. It is not designed to bear the weight of whole universe here. So many things goes inside your mind. And the wrong posture, neck goes forward, 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 forward. So then after some time, these muscles forgot how to contract. Pressure comes to my lower back, and this lower back, after the mid back, has to hold more weight on your lower back. So this compensate, after this compensate, and the pressure goes to the lower back. And that's why the lower back injury comes every day to your routine level. So guys, that's why the forward-headed neck, or what we say nowadays, you are doing this, we call it text neck. You're texting too much, forward neck. Or have you seen the pigeon? They do like this, we call it pigeon neck. So the choice is yours, which type of neck you want in your body. So the problem here, the cervical spine, right? So cervical, how many? 7. So these kind of imbalances, the forward-headed neck posture, text neck. Which kind of postures you have now? We have to check where my neck it is. Just check randomly to the different people that where their neck posture is going. So these muscles get passively lengthened. And after that, your middle back and lower back muscle has to function more. So whole imbalance comes here. So we know that in the poses, I know that is the problem. Mostly in the poses when you're trying to do, we have to check that the neck has to be soft and long. No more compression has to be there. You ask simply people that go into that pose, bend backwards, what they try to do, they throw the pelvis and they drop the neck like this. If you have any neck injury here, any neck problem, if you're drooping it, it creates compression between your vertebrae. Create compression to your disc, create compression to your nerve endings. So this is the main problem which we are facing. So we have to correct that problem, guys, that how to balance it. We have this problem that forward-headed neck posture, text neck. Rather to create, don't drop your neck back, look forward, this is we have to correct in the alignments. But not that time, how much time I am doing a pose? I'm holding for 3 minutes, I'm holding for 5 minutes maximum on that time, right? I'm repeating that pose 2 times, 3 times, or 4 times, or 5 times a day. But after that pose, after the practice, you go back to your normal routine. No awareness, we have to prevent, because the prevention is better than the cure. As you go back to the work, again this. And if you are doing this for 3 hours, 5 hours, and no more protection, no more overcome for that, this is not present with you in between the regular intervals, that create more imbalances. So that's why I don't teach only just to correct the neck, we have to teach some preventive exercises with that also. So you can deliver something different to your students. That, okay, you have a neck problem in the alignment class, in the class, do that, do this, that's okay. But after that, you can speak to a student after the class, oh, my dear friend, whatever the name it is, I want to help you, just do that exercises for a while. In between the interval time you get at your office, or take a time for yourself, do that exercises, strengthening, stretching, and prevention is there. So what we can do here now, for this problem, the forward-headed neck posture and the text neck. We can use some exercises like neck isometrics exercises. So you have to 10-second hold, 3 to 5 repetitions. Each side. We can do neck side stretches. Ten seconds hold. 3 to 5 repetitions. So this also you can add in relation to the alignment and adjustment. How to do these exercises? You don't need too much big space. You don't need any equipment. Just you need your awareness, your body, and yourself. So we can do it easily. Isometric means, iso means same. Metrics means meter is the length. So when the length of the muscle remains same. So when I'm trying to push the wall here, if I'm trying to push the wall, so what is happening here? My length of the muscle is not getting changed. So this is the isometric. Iso means same, metric means length of the muscle. So when the length of the muscle remains same, that kind of exercise we say isometrics. So what you have to do, just if I change the angle of my chair, from the back we have to bring our palm on the back of the skull, and what we have to try to push from your head and just register from your palm and hold it for 10 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So this is starting from the back. Then I have to use that, if we change the angle so you can look at from the side. From the side, palm on the side of your head, and just try to push towards your head like this. Make sure neck has to be neutral. It's not like this is wrong. Not like this is wrong. So palm just on the side of your head and try to push your palm towards your head. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10 and release. Same thing you can go with this other side also. And release. Then we change the angle because then we have to go from the front. Just palm on your forehead and just try to press your palm from your forehead and resist from your palm. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10 and release. So counter force from the both side. How to do the neck stretch? It's easy too. That you can just lock. You can lock or you can hold the handle of the chair. Bring your other hand up or other shoulder up. Go from the other side. Stabilize it, right? So your shoulder could not go like this way. This is wrong. If you are doing this, it is not the complete stretch. So stabilization must needed before stretching. The one end has to be stabilized, then you can feel that something is stretching. If one end is not stabilized, that end of the muscle cannot be get completed. So stabilize it, hold it, do it like this way and stretch on the side. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, release. Hold it from the other side. If you don't want anything to hold, so then lock the shoulder on the back like this way. Just lock your shoulder here if you don't have anything to hold. Then we go for other side. So we lock it like this way. Stretch your arm up, place it on the other side of your head and stretch on the side. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1 and release. So this 2 exercise you can stretch. You can strengthen your muscles. So if you are doing these 2 exercises after 30 minutes or after 1 hour, when you continuously working on your laptop and PCs, what will happen after that? No magic, right? But whatever the muscle you have overused, if you are strengthening it, it comes back into the shape. Whatever the muscle you have overused it, what is the muscle gets shortened, the other muscle which has worked, it becomes easily come into the original length of itself. So if you have after 1 hour, you have 5 minutes, go through that. If you do these exercises 3 times, 5 times a day, guys, you can feel the change in your neck pain and you can feel the change that some energy is going inside your brain. So it's not only the neck pain give you sometimes migraine, sometimes it's give you like vertigo because overuse of the muscle and the underuse of the muscles. And that affects your working pattern too. Because the neck pain sometimes it radiates up to the brain, it radiates from here to your finger to the toes. It can go anywhere because this is the base. This is the upper part of your body from where the whole nervous system is getting attached. So that is my request. Try these exercises and feel the change. So these exercises you can practice, which we have discussed earlier, that how to do it. So will help you more to enhance your working capacity too. Now some poses you can do like, or some things you can easily practice, like it will give you both improvement in your poses too, prevention of the injuries too, and bring more strength and the flexibility to your muscles. So one pose you do mostly, when you do the pose, if I ask you guys, you do the pose simply like the fish pose I'm talking about, right? The fish pose. Mostly people have tight shoulders, right? When we ask to do that pose, sometimes people say that place your both hands here underneath your buttocks, go like this way. So sometimes people what they try to do, they don't try to open the chest first. They try to roll the neck like this. Now you can see how much compression here you can feel if you're not lifting the chest properly. If for the beginners you want to teach that pose and prevent the neck injuries, you can bend your knees first, right? So you have something upliftment to engage the core here now. Try to press your buttocks down. And if you want to straighten that, after that you can straighten. So first you have to ask your student that lift your heart up. So as I'm lifting my heart up, I'm opening my chest. And then only back of the neck has to be soft and long. It's not only that if I'm not using these muscles, if I'm not opening the chest enough, what I'm trying to do, I'm trying to compress my neck like this. So what we have to do that, you have to, first and foremost, no compression on the neck. Neck has to be soft and long. Try to roll your shoulders blade back. So open your chest from here, right? Lift your heart up and then bring your neck. And no need to compress the neck or drop the neck completely. Just open the chest first. What we have to open? Open the chest first. If you don't have anything, if you want to practice this stretch also, you can roll the mat from here, right? You can roll the mat. And just put that rolling of the mat underneath your cervical spine, like this way. After rolling the mat, you feel that there's a traction, natural traction you can feel. So this rolling can release the muscle on the back of your neck, and you can feel less pressure on your neck. And slowly, first, drop your shoulders down, take your chest back, and release your neck. So this also you can practice by rolling the neck or by rolling the mat and place the mat underneath on your base of the skull. Right? This is what we can do. So after that fish pose that we have discussed, what we can do, you can easily do, you can do one pose every day as you get time. You can use block. If you don't have a block, you can just fold the blanket or fold the towel. So this is the relaxation pose which we call say Sphinx, or sometimes we say about the modified crocodile pose. So how we have to do that pose just to bring the awareness to the neck muscles? Here we can do. So make sure the neck is not going more forward. Try to lift a little bit, engage your shoulders blade back, or if you feel that your neck is getting more down, you can use the block like this way. Place your elbows on the block and just give slightly natural upward traction to your cervical spine. So this you can use, guys, and release after that. Next pose you can use in your yoga, the cobra pose. For the cobra, you can just place your palms along your trunk, elbows close to the trunk slightly, because you can feel that muscle contraction around your shoulder blades. If the elbows are going wider, then there is no contraction on your shoulder blade, right? And the neck goes forward. As you are bringing your elbows close together or the palms close together on your trunk, you can feel that sometimes I can feel as you release the shoulders here and you try to contract your shoulder blades along the spinal column. Take your shoulder blade, towards the spinal column, bring your neck back, and just not a complete cobra, just try to feel your neck muscles and hold it here for a while and slowly release. So this also you can do, or if you want to go more and just try to check your neck. Where is my neck? Going forward, or I am engaging it. If you're not using your shoulder blades, muscles around, neck drop like this. If you're trying your shoulder blade back together, easier for you to get your neck backwards. So these are the poses that we can use, that you can do pose also, or you can get the some good effect, some good benefits from the poses too, my dear friends. So the poses which we have discussed for the forward headed neck, for the pigeon neck, for the text neck. Exercises we have discussed earlier. Now some poses which we can apply in our activity of daily living. So the poses are as follows. The fish pose with modification. The modification which we did, we roll the mat and we place underneath the base of the skull. So 30 seconds you can hold the pose, starting with 20, 15, 10, whatever suits you, but comfortable zone, 10, 15, 20, 25. Maximum to 30, 3 to 5 reps. Then you can practice here Sphinx. The Sphinx pose, 30 seconds hold, into 3 to 5 repetitions. Then last we use Cobra. The Cobra pose, 30 seconds hold, 3 to 5 repetitions. As you feel that I'm getting my neck muscle strength back, mobility is good, you can increase the time up to 60 seconds and repeat it to 8 to 10 times too. But in the beginning, start with 10 seconds, maximum 30 if you want to go with that, and 3 to 5 repetitions. So guys, if you are doing these poses and you are doing the exercises, and you are taking care of your neck in the postural alignment, so will it be possible that you can make some changes with your neck muscles? Just try it, right? The neck is the upper part of your body. And if the upper alignment of the body is disturbed, it affects the whole middle part, lower part of the body too. So we have to take care, and that 70% of the people has neck stiffness, neck tightness due to overuse nowadays, as we have discussed earlier. So if you want to get your neck and use it properly in the postural training, in the posture, in the asanas, and people come with the problem sometime, and if you are not giving only the forcing way to drop your neck, compress your neck, lift your neck up, these kind of commands we don't have to use. Just simple, always remember the back of the neck has to be long and soft, whether you are doing forward bending, backward bending, or the shoulder stand. That kind of person who has any pre-existing history of the neck. So if the neck injuries are there, be careful. Sometimes it gets more worse. So for the neck balance, if you are using all these things, I am taking care, or you are taking care of your students during asana classes. If you are giving them individual alignments, you can feel that the pain is reducing every day, and the neck alignment comes, and you can get the natural curve on the neck. If this curve is not maintained, if it is going like this, there is a straightening of the curvature. So what we say, loss of curvature on the cervical spine, and then the degeneration starts. And then it creates compression on your disc and create compression on your nerves. So in the 7 days, 10 days, you feel the pain around the neck. After that, person complain, my pain is radiating from my neck to my arm, to my forearm, to my thumb, to my fingers. After pain, you feel tingling, numbness. So the intensity of the disease, intensity of the misalignments getting more worse every day. So that's why my request to you, my dear friends, just not only the asana prevention, we have to give them some modification, we have to give them some preventive exercise, so then we can prevent the injuries or imbalance. So So prevention is better than the cure. So prevent your neck, take care of it, take a little pause, check, bring awareness back to yourself. After 30 minutes, 40 minutes of your work, check where is my neck. Oh, it is going forward, bring it back. Do some exercises and bring your spine more happy and healthy. So take care of your neck. We'll see you in the next class. And until that, you have to go check the neck posture, the neck alignments with your colleagues, with your neighborhood, whatever the family you have, the family person, the family members. Get back through the more questions with me, right? So we can discuss and we'll give you more individual alignments. Till then, thank you so much. Namaste. Take care of your neck. Namaste.